Hello, my name's Greg Starbuck. I'm a licensed therapist here in California, and I do these topics and kind of areas of interest for those of us that enjoy this profession or are called to this profession, and or the helping field, or right helping professions. And it's just short, 3, 5, 7, 9 minute, little vignettes and dialogue. Well, not too much dialogue because I'm the only one talking, but uh, the idea is that I just present a little topic there, and you get a chance to listen. It's just for information, entertainment, maybe a little bit, as I indicated, and a little information as I've stated. Today's topic. Oh, and by the way, please don't use this site for therapy. It's not for therapy. I would encourage you, if you have some therapeutic concerns, that you contact a professional so you can get them worked on. Anyway, let's get started on today's topic, which is confidentiality. Seems obvious, right? Well, I lived and worked in the same area for many years, so I ended up coming across a lot of clients that I have seen and worked with, either from the hospital or a clinic or um, my private practice. And I wasn't quite sure what to do in the beginning because it was sudden and in my face. And I worked across a number of venues over the years, including 12 years working with adults for anger management and domestic violence and all kinds of other things. And I did that for a long time and hundreds of patients in that venue. And so many of them live in the area. So I would come into contact with people on a regular basis. Um, and sometimes with my family or whatever, and it was always okay. I never had a problem with it. I think some do, but uh, I'm a Christian. I work with folks at God's disposal. I whatever His discretion is or whatever He wants at His good pleasure. And if He's got someone in my path that I've met and worked with, then if they come into my path, then I'm as cordial and nice. And my family has learned over the years, and very appreciative of this, that they never question. They just realize it's probably somebody I worked with or talked with or in the past, and um, they pretty much let it go at that. Um, anyway, the idea of confidentiality is very serious, and it takes a little while to learn to keep your client base or patient base, whatever it may be, on the whole, 24/7. It stays in your head. It doesn't go anywhere. Now, you may have an agreement with your facility that you're with, that you can discuss clients during supervision or something like that, or perhaps you have someone that you work with at work, like when I was in the hospital or clinical setting, that you talk about the cases. You don't give names, but you certainly can talk about cases and together, and get some feedback one to another. And there were times of therapists that I worked with for a long time that I would make referrals to them because I knew that they inherently were better at that particular situation with that person or couple or family than I was, and I would readily make the reference to them. Uh, but confidentiality, unless the patient's going to hurt themselves or hurt somebody else, on the whole, or maybe there's some minor involved, or there's something. I mean, other than the legal issues and concerns, let me encourage you to just keep all the cases in your head and use your relationship with Jesus Christ and disclose to Him. Now, something that was helpful for me from the beginning, and I was very fortunate that I was a Christian before I got into my profession, is that I knew that He already was aware who I was going to see. He knew exactly who these folks were, all their history, and that He had equipped me to work at whatever level I was at the time for those particular clients or patients. So I had confidence in Him, and that I would pray, and because I prayed for my clients, and um, that that He would help me to manage the confidentiality. Now, whenever I saw a client or see a client or interact with a client, I am aware that there are being things talked about that might be kind of interesting to tell other people, but When you work in the same community, you really don't want to do that. And I've been in restaurants, and I've been on elevators, and I've been on escalators, and I've been walking just down the streets in my community, and people will come up and start talking to me, and sometimes I'm not really sure which venue they were at. I had one person come up to me, and they were kind of struggling financially. I thought they were a driver from one of the locations I was at. And they said they were hungry and they wanted a little something to eat. And I thought, well, maybe they'd lost their job. So I bought them a little something to eat. And about halfway through, I realized they were an old patient. Oh my gosh. Now, I didn't disclose who they were. It's just, oh, geez, you really do, after 20 some years, come across people you know. Well, I made it a habit that in my sessions that I would recognize these were God's sessions. These belonged to the Lord, and that he would take the burden of any healing that was going to occur, right? Or any progress with that particular person, that it was his. And that relieved me of a lot of pressure right there, because I did not have to process the struggle perhaps of that particular session. I could just give it back to him because he's the one doing the work. I'm just there to facilitate what he has me doing. So this made confidentiality much easier for me from the very beginning. And then I would interact with other professionals, never by name with the client, but to get professional feedback on their thoughts or something like that. Anyway, confidentiality, what a topic, right? It can be a real struggling one. But if you follow the legal guidelines of what you're supposed to do and not do in confidentiality, you'll probably do just fine. And if you're a Christian, give it to the Lord, right? And keep your mouth shut. Well, that was today's topic, and God bless you, and I'll see you on the next topic.